And action! Here we are, live, Doctors of Podiatry, Saturday. So yesterday we put out a really great video on what is PRP. Blood. We've already drawn the blood. So we have the blood, whole blood, centrifuge. Put it right in there. It's gonna close. Now, it's gonna start spinning. Let's move back there. Thank you very much. Blood has been drawn, centrifuge. We're spinning. It's gonna go ahead and separate. Once it separates, part two. Here we go. We're gonna go ahead and open up the centrifuge now and remove the tube. Now let's go back to basics here, because I'm sure everyone did watch our wonderful video on what exactly is PRP. So here we have the two components. We have the plasma, and we have what we call the cellular components on the bottom. We're gonna remove, right, the top portion, which is the plasma, which contains the nutrients, the growth factors, and important molecules. And we're gonna go ahead and deliver them into the affected area of this patient. Part 3, Dr. Toe Jam. Here we go. Here it is, a liquid gold. We're gonna go ahead and now infiltrate this, the plasma, the PRP, into the affected area. The patient has the most amount of pain in this area, so we've already anesthetized this area a little bit. Okay, for a second there, we were having a little argument with the needle. Plantar fasciitis, plantar fasciosis, the inflammation of the longest ligament of the foot is mostly in this area here. Her discomfort is mostly in this area. So we've already demarcated everything with the ultrasound, and we're gonna go in. And the patient may feel some pressure, maybe. We'll stop there a second. People definitely need to understand that there is discomfort. We tell that to all our patients. The truth is that we need to let the area sizzle down. What I'm gonna go ahead and do is I'm gonna pull back a little bit, and then I'm gonna infiltrate a little bit more. How are you doing up there? I'm gonna remove the needle. For this atypical case of plantar fasciosis, very intricate anatomy in the foot. I'm gonna go ahead and immobilize the area, and eventually we'll send her for some physical therapy. So like always, you can always follow us on Facebook, Doctors of Podiatry, Instagram, Dr. Toe Jam, and if you guys have any questions, please feel free to reach out to us. Thank you for watching.